Hello, and thank you for joining today's webinar. We're ready to begin. Today's webinar is eligible for one contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. No one with the ability to control content has any relevant financial relationships. In order to receive your contact hour, you need to complete the entire webinar and then fill an evaluation form out at the end. The webinar is being recorded and will be available via the Sigma repository within a few business days of the recording. Information on how to access this will be emailed to all attendees 1 week after the webinar. Following the presentation, if we have time, we will have a question and answer session. You'll see your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so that the message makes it to us. Please use the Q&A for questions and the chat feature to interact with other participants. We would like to thank our speaker for sharing their expertise with us today. Of note, thoughts and views expressed are that of the presenter and do not necessarily reflect that of Sigma. Our speaker today is Dr. Siobhan O'Connor. Dr. O'Connor is a senior lecturer in the Florence Nightingale Faculty of Nursing, Midwifery, and Palliative Care at King's College London. She also holds an adjunct associate professorship at Western University, Canada, and is a liaison to the United Nations for Sigma Nursing and Information Systems. I apologize. Dr. O'Connor has a multidisciplinary background with bachelor's degrees in nursing and information systems, completing her PhD in health informatics, and has nearly 20 years combined experience in industry, clinical practice, and higher education. Her research focus on co-designing, implementing, and evaluating technology in nursing, and she leads the AI Nurses Network, a clinical research network on artificial intelligence and nursing. Welcome, Dr. O'Connor.
Hi, Jen. Thank you for the lovely introduction, and hello, everyone. Thank you so much for coming to this session. I hope you get a lot out of it. Hopefully, I can take over the controls and get started with the presentation. Lovely. Well, good afternoon or good morning or good evening, wherever you're joining us from. And thank you for taking time for the Sigma webinar in your busy day, whether you're watching it live today or catching up on the recording. From the chat and all the posts, it looks like we have attendees from all different regions of the world, covering America, Europe, the Middle East, Asia, and Oceania. So a very warm welcome to you all, and thanks to Jen for the kind introduction. So I'll skip my own introduction and jump right in to the presentation. So this is just an outline of what I'll be talking about today. But before I start, I want to give a nod to Florence Nightingale. She's most famous. Oops, I might jump back again. Sorry, Megan, if you could bring us back to that slide, that'd be great. Thank you. Brilliant. So as I was saying, I just want to give a nod to Florence Nightingale before I start. She's most famous for her work on infection control during the Crimean War, but Florence had a background in statistics before she became a nurse, and that mathematical background was really instrumental in a lot of the pioneering work she did throughout her life, including her work on infection control and her use of data to improve public health, which is what she focused on for the latter part of her career. So she's often referred to as the world's first nursing informatician, and no doubt if Florence were here today, she would be the leading light in relation to digital and AI stuff in nursing. So I'm really excited to do this webinar on the World Health Organization's State of the World's Nursing Report, which was launched on the 12th of May this year to celebrate International Nurses Day. And I'll talk about my specific contribution to that report in terms of digital nursing education and practice a little bit later on. But before I jump into that, I just want to give you some insights first into the Sigma UN liaison role, because the World Health Organization is the main agency of the United Nations that deals with health. And our UN work at Sigma is really vital to representing the nursing profession at that global policy level with the UN. So hopefully that ties everything nicely together, because this particular WHO report on nursing only comes out every 5 years, and it's really critical for influencing global policy and advocating for nursing as a way for countries to achieve the Sustainable Development Goals. So I'll spend most of the webinar talking about that, and then I'll finish by sharing some resources that might be useful for you on digital nursing, education and practice. So I thought it might be helpful to start off with an overview of the United Nations for maybe some of you who are not very familiar with it. The UN was founded in 1945 at the end of the Second World War as an intergovernmental organization representing 50 different countries. They gathered at the UN Conference for International Organization in California. And between April and June of that year, they proceeded to draft and then sign the UN Charter, which essentially sort of gave rise to this new international organization called the United Nations. So the idea really was to create this intergovernmental body to prevent another world war, just like the one people had lived through. And a couple of months after that conference ended, the UN officially began on the 24th of October 1945, when the Charter was ratified by several countries. And so fast forward to today, now there are about 193 member states or countries that are part of the United Nations. So it's really become a place where world leaders of different countries can come together to talk about key global issues that no one country can address alone, and really to agree a way forward on those key issues. So they could be covering things like peace and security, human rights, humanitarian aid, sustainable development, climate action, etc. A whole range of other global issues, some of them related to health, and then some related to broader sort of public policy. And so, of course, you'll know that Sigma is a global scholarly nursing organisation that really aims to develop nursing leaders to transform healthcare. There are currently over 100,000 members across 100 countries with about 600 chapters in 7 global regions, which is really an amazing achievement. So, because that's a huge amount of impact if you think about where Sigma members are located, and many of these are outside of North America. So, for example, last year in 2024, Sigma chartered 3 new chapters, 1 in Spain and 2 in Saudi Arabia. So Sigma, I think, is really capable of representing nursing very well worldwide. Sorry, just go forward, not backward. So in 2012, Sigma had the opportunity to be granted what's called a special consultative status at the United Nations. And this was done through the Economic and Social Council, one of the principal organs of the UN, or it's called ESOC for short. So there are several different levels of consultative status, such as a general status, which is typically reserved for large international NGOs that have a very broad geographical reach and where their areas of work really align quite nicely with the agenda of ESOC. Then there's what's called special consultative status, which is what Sigma has been granted. And this is for NGOs that have a special knowledge areas or expertise that aligns with a few of the fields of activity covered by ESOC. And then finally, there's what's called roster status for organizations that don't fit under general or special status. So those are the ways in which NGOs like Sigma can engage with the United Nations. And as of December 2022, there are over 6,400 NGOs, and that number is going up all the time. So it's great that Sigma has this special status with the UN. And I'll talk a little bit more about that in detail so you can understand what that means. So with its special status, Sigma and us as UN liaisons engage with the United Nations in a number of ways. We represent the nursing profession at UN events. So that could be going to the General Assembly in September and other UN events throughout the year. And we bring that nursing perspective to all of our discussions with partners at the United Nations to make sure that we are influencing policy discussions and debates, whether that's through oral interventions, written interventions, or participation in meetings. We're really trying to build relationships with our global partners. And so that work is very sort of outward facing. And then the other piece of work is that we bring all that knowledge back and we try and disseminate and mobilize that knowledge of the sort of global policy landscape, not just for Sigma members, but for the nursing profession in general. So oftentimes when we attend UN events and learn about the sort of emerging policy trends and issues, we will write and publish articles, we'll do webinars like this one, we'll speak to a lot of Sigma chapters to try and help the nursing profession and nurses think more broadly about how they can engage in their local context within that global space. So this is the current team at the moment. There are 9 of us in total representing nearly all regions of the world, and we serve a 3-year term, and then we rotate off and are replaced by other Sigma members. So if you do a lot of work in nursing or health policy, then this kind of role might be of interest to you. Keep an eye out on the Sigma website, your local chapter, social media, etc., because these roles are advertised nearly every year. In terms of the current team, as you can see, Abir is from Saudi Arabia. Myself and Charlotte represent Ireland and the United Kingdom. Jatana, Jasper, Amy Staley, and Jerry are from the United States, but they also have affiliations in parts of Asia and Africa. Regina is from Canada, and Amy Giselle is from Mexico. So there's a really nice mix of different genders, ethnicities, geographic locations, areas of expertise in nursing, from policy to education, research, etc., and also different career stages, with some of us earlier on and others more mid to late stage in our nursing careers. So it's a fantastic team to be part of, and I think our diversity serves us well. So when we're working to influence policy and amplify the voice of nursing at the UN, and we also update the Sigma board each year on all the work that we're doing. Just to give you a better idea of the size and complexity of the United Nations, this is the UN system if you're not familiar with it. And as you can see, it's got many different subsidiaries or organizations, commissions, departments, and offices. But the UN has 6 principal organs that were established in its charter in 1945, and they're listed on the left, which are the General Assembly, the Security Council, the Economic and Social Council, the Secretariat, the International Court of Justice, and then the Trusteeship Council. And it's the 3rd principal organ, the Economic and Social Council, that Sigma is part of. So this is a sort of principal body really for coordinating policy review and policy dialogue and recommendations on different economic, social and environmental issues. And ESOC also do a lot of work in terms of implementing the internationally agreed development goals, such as the current Sustainable Development Goals, or SDGs, that are in place until 2030. And as you can see on the far right, the World Health Organization is one of the specialized agencies that falls under ESOC's remit at the UN. And I'll come back to talk about the WHO and its work on nursing in a minute, but that's where it fits in the UN picture. And so as UN liaisons for Sigma, we engage with other UN organs, in particular the General Assembly, which is the main deliberative policy making and representative organ at the United Nations. So all 193 member states of the UN are represented at the General Assembly, and that happens each year in September at their headquarters in New York, where everyone convenes to engage in a lot of policy debate. So you'll have a lot of heads of state, as well as civil society organizations like Sigma. So some of our team go along to that event to advocate for nursing, as well as individuals from the private sector and, as I mentioned, world leaders. So everyone really comes together to talk about pressing global issues and agree how to make progress on those. So that's just an overview of the United Nations, and I hope you can see where the WHO fits into the Sigma's UN liaison work. And now I'll talk more specifically about the WHO and the state of the world's nursing report. So as I mentioned, the UN is a specialised agency of the United Nations focusing on global health, which feeds into ESOC, and it's the main UN body responsible for health, so it's a very important organisation. It provides leadership and normative guidance on all areas of health, as well as providing technical support to countries, and it monitors health trends and emergencies, as well as generating evidence so that the policy guidance it provides WHO member states is sound and of the best possible quality, just to enable those countries to make the best decisions at national and local levels. And because the WHO is a UN agency, its work obviously is directly aligned with the Sustainable Development Goals, in particular focusing on Goal 3 around good health and well-being. And within that specific SDG, there are a number of targets for countries to try and reach by 2030, which include providing universal health coverage and financial risk protection, which means access to good quality essential healthcare services and access to safe, effective, quality and affordable essential medicines and vaccines for everyone. The WHO also has a specific governance framework which has two main mechanisms. One is the Executive Board, and this is a smaller body of member states who decide on the agenda for the World Health Assembly, and the other other kind of decisions around WHO budgets and different committees, etc. And they meet twice a year at the WHO headquarters in Geneva. And then the World Health Assembly is the main way that WHO member states govern global health. So this event takes place in May every year, and that's when all of the health ministers come together to discuss important health issues, and that's where resolutions or decisions happen and other important negotiations take place. And I wanted to mention this because this is where the State of the World's Nursing Report came from. So in 2019, at the Executive Board, a member state proposed dedicating 2020 as the year of the nurse and midwife. And then that proposal went to the World Health Assembly in 2019, where it was agreed by all member states. And then that enabled the WHO and its partners to start a number of initiatives throughout 2020 to promote nursing and midwifery, one of which was the very first State of the World's Nursing Report. Another relevant piece of work that the WHO started in 2014, which was agreed by the World Health Assembly, was that all WHO member states decided on a strategy for the health workforce to help countries achieve universal health coverage and the SDGs on health. So this is a global human resources strategy that runs to 2030, and it's got four main objectives. So they are around areas of performance, ensuring investment so we have enough resources going to health workers, that there's capacity going to the right places locally and nationally, and also that we have adequate data and evidence which informs the basis for policy dialogue, decision making, and policy action. So it's the very last objective, the one on data, that's probably the most important, because countries agreed to generate data and evidence on their health workforce, including nurses and midwives. And that data is what has been used to create the first State of the World's Nursing Report in 2020, and the most recent one this year, and hopefully the next one in 2030. So the WHO was really focusing on how to get enough investment in healthcare workers' education and employment to address the shortages in nursing midwifery in individual countries as well as different regions and globally, to make sure we have the components necessary for universal health coverage, that they're in place and that they're working well for everyone. So having obviously really strong, robust data from countries on health and their health workforce is really the basis for all intersectoral policy dialogue that happens, so that when all the health ministers come together at the World Health Assembly in May each year, they can look at the data, really discuss the challenges facing global health and the workforce, and then make some decisions and agree on a way forward to try and address some of those challenges. So the first State of the World's Nursing Report was launched by the WHO in 2020, and that report gave global, regional and country level data in a number of areas. I don't know if you've had a look at it yet, but the publication is available in about 9, if not 10 languages by now. And all the country profiles for the 191 countries that provided data are available on the WHO website if you want to look in more specific detail on anything in particular. And the purpose of that first report was really to provide a picture of the global nursing workforce that wasn't really available before at such a sort of granular level. So it's a really fantastic report, and it's helped inform policy dialogue both within and between WHO countries and regions, so that ministries of health know when and where to invest in the nursing and midwifery workforce, and how to use that really to accelerate progress along the Sustainable Development Goals. Sorry, I'm a little bit slow with the slides. Just go back one or two. Oops. Oh, sorry, Megan. Would you be able to take me back to that slide if possible? Thank you so much. Brilliant. I think I keep hitting the wrong button. Super. So the first State of the World's Nursing Report was then presented at the World Health Assembly in 2020. And after that, the WHO decided for the very first time to request the World Health Organization to develop the next iteration of their strategic directions, which was a technical document produced by the WHO outlining a global strategy for the nursing and midwifery professions. So that was another really important document, because it meant that the World Health Assembly formally adopted this strategy at the Assembly in 2021, and the resolution it issued called for all of the member states to implement the strategy at a country level and to monitor its progress. So this sort of explicit sort of mandate really helps ministries of health in every country to adopt the 12 priorities for nursing and midwifery outlined in that strategy, and to put those into action via nursing leaders in every country. So aligning sort of national and global policy priorities is important and can really help strengthen our profession. So very briefly, the WHO's Global Strategic Directions for Nursing and Midwifery covers 4 policy areas, including education, jobs, leadership, and service delivery. And each of these 4 areas has several policy priorities. So for example, under education, it includes things like making sure the quality of education programs is high and meets competency-based education and accreditation standards, and that nursing faculty are adequately prepared to teach these types of high quality programs at the levels that are best suited for the individual health system. Under jobs, some of the priorities are things like using labour market and health data to plan future nursing and midwifery services, where they need to work and how to train staff, so we have enough nurses and midwives to deliver high quality care, and managing migration and international mobility of nurses and midwives. Under leadership, the main policy priority here is around developing senior leadership positions at a national level and positions for nurses and midwives in ministries of health, so that we can put into health policy the management of the nursing and midwifery workforce. And lastly, then under service delivery, the priorities here are around strengthening regulatory frameworks for nurses and midwives and ensuring there's a healthy working environment for nurses and midwives across a range of care settings. So I hope that background was sort of useful to help explain where this year's State of the World's Nursing Report came from, because it's structured around the 4 policy priority areas in the WHO's Global Strategic Directions document. So they're sort of inextricably linked together, and they're 2 very important publications from the WHO for all nurses and midwives worldwide, especially for those who work in leadership positions. So I'll move on now to discuss this year's State of the World's Nursing Report. So the 2025 report has lots of great data in it to inform that policy and decision making, with detailed descriptions of the current situation on nursing midwifery globally, as well as by region and country, to allow for planning into the future, especially to 2030 and beyond, so that every country has that data and we have it at a regional level and a global level as well, because that evidence is really critical to supporting the governance decisions that are made by the ministries of health at the World Health Assembly each year, and just by ministries at a national level in their own countries. I won't go into all the detail in the report today, but it's publicly available on the WHO website if you want to read it in detail. And I'll spend the rest of the presentation now talking about the recommendations that I helped draft with some of the senior technical officers at the WHO specifically on digital nursing education and practice. So most of the recommendations on digital nursing relate to education because that's really the bedrock for nursing jobs, nursing leadership and service delivery. And one of the key overall findings in the report is that some of the bottlenecks to sort of scaling up nurse education are the demands on sort of digital learning environments. And as well as that, the use of digital technologies and artificial intelligence has expanded in different areas of nursing education. But of course, there are sort of challenges with that in respect to equity, competency, the readiness of faculty, as well as clinical learning opportunities. And I'll go into a bit more detail from the report about what this means because those findings are quite high level. And as well as the overall findings, the WHO report highlights a number of emerging policy priorities, and two of those under education are related to digital technologies. So firstly, the expansion of blended learning, especially in a post-COVID world, really requires more investment in infrastructure and resources to support equitable and relevant digital forms of education. And that education standards should include digital competencies for contemporary practice. So on a country level, you might translate that into meaning that nurse education leaders should invest more in technical infrastructure like e-learning software and up-to-date computing equipment for students and faculty, and invest more in learning technologists to help support the development of digital learning environments and digital content. Nursing regulators also need to update their education standards so that digital and AI competencies become a necessary component of all types of education programs, such as bachelor's and master's degrees. And the other policy priority is to ensure nursing faculty get competencies in the best pedagogical methods and technologies. So ways that this could be done at a country level by nurse education leaders include developing and rolling out structured forms of orientation and mentorship, improving working conditions, whether that's working hours or more flexible or hybrid working arrangements, appropriate remuneration and career advancement, and opportunities for faculty to develop digital, including AI competencies so that they can facilitate student learning, professional development and patient care. So a lot more investment is needed really to support nursing faculty in their roles to make sure that we can deliver high quality education to students. Oh, sorry, scoot back one. So to support nursing faculty whose roles can include not only teaching students, but also program design. Oops, sorry. Oh, sorry, Megan. Thank you. I think it was jumping around. Brilliant. Thank you. That's where I was. So sorry. And just to support nursing faculty whose roles not only include teaching students, but program design, implementation, research and publication, as well as institutional leadership, most of those requiring digital technologies of some kind. The WHO recommend that nurse leaders provide both technical and financial support to faculty to incorporate digital technologies into all levels of nursing education to ensure that nursing students and practicing nurses have the requisite digital competencies. So for example, such as understanding why and how to use electronic health records, telehealth or sort of remote monitoring systems, decision support tools, mobile applications or apps, robotics, AI tools, etc., to support patient care and population health. Another suggestion where it may be challenging to have at least maybe one permanent member of nursing faculty who has expertise in informatics is for nurse education leaders, whether they're maybe deans or heads of nursing school, is to employ faculty from computer science or engineering just to bring that specialised knowledge of digital competencies into nurse education. And they could work with nursing faculty to integrate many different topics in informatics into a range of curricula and teaching programs. Sorry, I keep skipping by the slides too quickly. There we go. Perfect. And while digital technologies can be great for nurses, there still are numerous barriers, obviously, to introducing them in education and practice settings. So I think every country is still struggling with some elements of having good quality internet that's easily accessible everywhere in both urban and rural areas, and that's affordable for everyone to use. The cost of technology obviously can mean a lack of computing equipment necessary to teach students or deliver care to patients. And cost can also impact the amount and the availability of technical support that's always needed to make sure different kinds of digital tools run smoothly. Poorly designed technologies can also cause problems for nurses, students, and patients. And of course, digital literacy is an issue because not every nurse or student has the knowledge and skills that they need to make the most of digital technologies. So, of course, these are some of the barriers to be aware of that may impact your country and your digital health initiatives in nursing, whether they're aimed at education or at professional practice. Goodness, I really can't stop jumping around. I'm trying to land on the right slide. Oh, one more forward. Great. So we also included an area in the report that discusses artificial intelligence in nursing education specifically, such as using generative AI tools like ChatGPT, just because they're so common now that students are starting to use them and that nursing faculty need to get to understand them. So we've included some practical examples from published research of AI being used in nurse education. So some of the applications of AI are clear. And then in that section, we've also presented a short SWOT analysis highlighting the main strengths, weaknesses, opportunities, and threats of AI that could affect nursing education, because artificial intelligence is not a perfect sort of technology and it does create some problems. Yes, it definitely can help us, process large amounts of digital data, whether that's text, images, audio, or video, and it can do that very quickly, enabling, different AI tools to respond to nursing faculty and students with relatively accurate written or audiovisual outputs, whether that's video or images. But the downside is that artificial intelligence is only really as good as the data it is trained on. And so this can introduce bias and produce inaccurate outputs, which means that nursing faculty and students should always be critically aware and critically analyse the outputs of any AI tool and not rely on it 100%. And while AI can certainly help us create, interactive and more adaptive and engaging educational resources that can improve learning and support students in developing communication, critical thinking, and other skills, there are obviously concerns about AI's impact on copyright, privacy, and professional accountability, with plagiarism concerns if AI is used excessively by students. Digital inequality is also an issue, as nurses and students who cannot access and use AI tools may have reduced educational and career opportunities. So hopefully that box in the report might be useful to you if you're thinking of introducing generative AI tools like ChatGPT with your nursing students, and all the references and case studies that we've used can be found at the end of the report. Of course, digital technologies can also improve professional practice and patient care. So, under service delivery in the report, the emerging policy priority is not that surprising, which is to harness the potential of digital tools and technologies to meet population and health system needs. So, nurses should be fully prepared and supported to competently use digital technologies across all different areas of professional practice, from education to clinical research and management. on a sort of country level, initiatives that nurse leaders might focus on are implementing electronic health records, creating or introducing decision support tools for nurses, or different forms of telehealth or other remote monitoring systems, so that virtual forms of care can be rolled out to patients at home or in a range of different primary or community settings. And in addition to that, the adoption of artificial intelligence and its use and sort of acceleration in the health workforce learning and practice will definitely require significant investments to build health workforce capacity. And again, that does raise concerns around equity and inclusivity if some nurses and midwives have access to these types of tools and others may not. So again, at a country level, nurse leaders might translate that into investing in upskilling staff in AI and procuring AI technologies that can support nurses to deliver patient care, while also making sure we contribute to the governance and oversight of AI in healthcare to make sure that it's used appropriately. And alongside those changes, nursing regulators also need to update professional standards of practice to ensure that nurses can work really to the full extent of their education, training, and assessed competencies, including the use of digital tools and technologies for health. So nursing leaders in every country, I suppose, need to work closely with regulatory bodies to make sure digital and AI is a priority and makes its way into professional standards for nurses. So I hope that gives you a nice summary of all of the recommendations for digital nursing education and practice that's in the WHO State of the World's Nursing Report this year. And so before I finish, I want to share some resources that might be useful for you if you want to develop digital nursing education and practice in your country. Obviously, bear in mind that digital technologies encompass a huge suite of different types of software and hardware, and they can be used by nurses in many different ways across a range of practice settings. So the next few slides are just a selection of resources that might be useful. Great. So firstly, of course, the World Health Organization has lots of useful resources on digital health. It has a global strategy, which is just finishing this year, but a new strategy to 2027 was approved at the World Health Assembly last year. So that should be published soon and it'll take us up to the end of 2027. And the WHO planned to initiate the development of a new global strategy on digital health running from 2028 to 2033. So that will be in the pipeline over the next few years as well. And again, hopefully will help countries develop their own national strategies around digital health that will be influential in nursing and midwifery. The WHO website also has lots of useful resources, including various publications and digital tools that might be useful for you. They have things like a digital health atlas where you can search and find country-specific projects on digital health. And they also have a global digital health monitor, which is sort of an interactive digital resource that tracks, monitors, and evaluates the use of digital technology across different countries. They also have a repository of national digital health strategies, which can be really useful if you're thinking of drafting up a digital health strategy for nursing and midwifery in your country. The WHO also support countries with digital health using this specific framework published on their website, and they're developing a country request portal which will be launched soon to facilitate the tracking of country requests for technical assistance around digital health. So do keep an eye out for that because it sounds like a great resource that every country can use. Of course, Sigma Nursing also has lots of great resources on digital health. You can use their Circles platform to connect to other nurses working in informatics because there's a dedicated group on that social media platform from Sigma that's very active. And you could get lots of hints and tips about how to introduce informatics into your nursing midwifery workforce. I also recorded a webinar for Sigma about artificial intelligence in nursing specifically, and that's available on their webinar repository. The QR code on the slide will take you straight there. And Nursing Centred also has lots of great articles from nurses working in different areas of informatics across the world. So hopefully those links are useful for you as well. And just to let you know that Sigma is also collaborating with the Johnson & Johnson Foundation to develop a nursing organisation course bank that will provide accessible, relevant and impactful educational content for nurses and nursing students. So this is a great initiative that will support nurses' professional development to advance healthcare outcomes across diverse settings. Sigma's existing courses that you can find on the marketplace will be on there. And I'm also developing a new course called Technology and Innovation in Healthcare, which will cover topics like telehealth, electronic health records, AI, and other important areas of health informatics. So keep an eye out for that course. I think the timeline for its release will be towards the end of this year, and it will be available for free for all Sigma members, which is great. So if you're looking for specific resources on artificial intelligence, because I appreciate it's there's more and more about it in the media and it's becoming more a part of our lives, then I set up the AI Nurses Network last year, which is a new clinical research network on artificial intelligence in nursing. And it's got lots of resources that might be helpful if you're thinking about introducing AI tools into nursing in your country. You should be able to find everything on our website, which is www.ainurses.com, and run through what we have available with you now. And also a big thank you to our funder, the Burdett Trust of Nursing, for making this network possible. So firstly, there's free training and education on AI and data science for nurses, and it's completely free and available. Oh, sorry, Megan, I've done that again. Oh dear. Would you mind taking me back to that slide? Thank you. Brilliant, thank you. So yeah, the training is available worldwide, and it's only in the English language at the moment, but you can pick and choose a range of introductory courses from things like how to code in Python, learning more about predictive modeling, machine learning, natural language processing, etc. And there'll be a new course on the ethics of artificial intelligence. It's currently under development, and we're hoping it'll be available the end of this year. If you are completely new to AI, then I'd recommend starting with the Demystifying AI course in Pillar 3. So if you follow the links on our website, you can log into the e-learning platform to access all these courses. They basically come in a series of self-directed videos that you can work through at your own pace. And there's some practical online toolkits for the more technical topics as well. So yeah, it's a great way, hopefully, for nurses to learn the basics of artificial intelligence. We also have some bespoke training for nurses on AI that a colleague and I are running over the summer. The dates for our online workshops in June and July are fully booked now, but we do plan to run more later in the year, and we'll advertise those on our newsletter and social media accounts if you want to sign up. And the workshops are really designed to help nurses learn about how to prepare a data set for predictive modeling, how to access it and clean it up, how to choose appropriate algorithms or other AI techniques to apply to develop an AI model, and then how to validate your predictive model so that nurses can start to learn how to create their own AI tools for professional practice. The network also provides seed funding for pilot projects on AI in nursing. Our funding call is closed now for 2025, but we funded 3 projects led by nurses that are exploring AI in different areas of healthcare. And we hope to run the funding call again towards the middle of next year. So please keep an eye out on that, for that on our website and social media accounts. We'll advertise it as soon as possible when it's ready. We also promote networking and other events from existing AI groups to connect nurses with AI researchers in industry. And we'll be running a hackathon on AI in nursing at my university campus in London in September to help nurses get their ideas for artificial intelligence off the ground. So you can sign up to our newsletter via our website. It goes out electronically every month to keep up to date with what we're doing. And also we promote other funding that's available, other research that's published on AI, and other developments really that's happening with AI in the healthcare space. We also have an active LinkedIn group where we post AI content every week. So again, you can try and keep up with what's happening with AI in healthcare, because it is a very busy space and there's lots of great things happening all over the world with artificial intelligence in healthcare. And then finally, we have a dedicated YouTube channel where we host a series of webinars from nurses around the world who are developing their own AI technologies or using existing AI tools and integrating these into nursing education, clinical practice, or research to try and improve patient care or population health. So I know artificial intelligence and digital nursing, it might seem like the furthest thing from what we do day to day, but it's not really. Historically, nurses have focused on hands-on care, and that will always be the core of what we do. But just like Florence, we need to use the data we collect on our patients to improve the care we deliver. And in the 21st century, the best way to do that is to collect data in a digital form and to analyze it using AI and other computational techniques to understand and improve nursing practice and patient care. So that's everything from me. Thank you for listening, and I hope some of that was useful for you. Do feel free to reach out to me and drop me an email if you have any questions about digital nursing education and practice. And I'm happy to take a few questions now if we've got time.
Okay, go ahead and place your Q&A in the Q&A box. And I just want to let everyone know, I want to reiterate that this recording will be both within the LMS for contact hours, as well as the evaluation, which we'll post a link to right now. And then it will also be available within our LMS. Also, Siobhan, we've had a lot of people asking if you would be okay with sharing your PowerPoint.
Sure, yeah, of course.
What I would recommend is, I know everybody put their email addresses in the chat, which we could not keep up with. So I would recommend taking down Siobhan's email so that you can email her directly for the presentation if you would like a copy of it. And she, I think you direct messaged me your email address.
Sorry. Yeah,
Oh no,
everybody.
I was doing that during the session as well. So let's take a look at some of the questions. Let me see. It's mostly about the PowerPoint. Is there work on common data elements in nursing practice?
Sure, we didn't mention anything specific in the WHO report because I guess every country's data needs around nursing might be quite specific. But the WHO does work with each country around a certain set of metrics that they ask for, which feeds into the report. I'm not privy to the details of those, to be honest, because the technical officers at the WHO do all that hard work, people like Kerry McCarthy and the team. But in terms of nursing data standards, I guess they do vary from country to country, but the International Council for Nurses have their own sort of global data standard for nursing that they're trying to promote, and the WHO have adopted that. It's called ICPN, because having consistent metrics across the world that we measure for nursing is really important. So then we can compare and contrast, realistically and reliably what's happening with the profession in different areas, and that having that data is really valuable to help us understand nursing to a granular level of detail and to try and improve areas of nursing that need more work maybe in certain regions and certain countries. So those are the data standards that I always refer to that are global, but then each country obviously has its own data and metrics that it collects as well. I hope that answers your question.
Great. And then we have someone who's interested in taking part of the AI Nurses Network, and they want to know how they can do that.
Sure, yeah, drop us an email. So I'll stick the AI Nurses Network email in the chat as well. I just have a separate email for that to keep my sanity. But it's also on the website. So please, yeah, drop me an email and we can link up and discuss that. Great.
So per our policy, the PowerPoint will be posted with the recording in the repository. So I can post that, Siobhan, so you don't have to worry about emailing a bunch of people, and we cannot email via Zoom the PowerPoint out. We need to put it on the repository so you can access that, so you can stop putting your emails in the chat. We'll have it in one central location for all of you, and we can go ahead and make sure that you guys have the repository link when I send out the email to everyone. But I just want to make it clear, that the emails you're putting in here, we're not able to email each of you individually the PowerPoint, so we'll put it on the repository. Does anybody else? Let me see if we have any other questions. Why does AI interpretation of data, why is it not as accurate as statistical software analysis?
Oh, that's a good tricky question. And there's lots of reasons, I guess. It can be down to the data set that's used. So there might be, I suppose, quality issues with the data set, that it could be missing elements, or some of the data elements might not be as robust as you would like. It can also be down to the type of AI techniques that you choose, the type of algorithms that you use to kind of analyze the data, because they all have their advantages and disadvantages, just like any technique. And oftentimes people will combine using maybe 5 or 6 different AI algorithms together to try and analyze the data from different aspects to make sure, yeah, the analysis is as good quality as it can be. But like any type of analysis, it's never perfect. So and this, little bits of insights get lost in translation. So it's always important to have your critical hat on when you're looking at the outputs of any AI tool, just to make sure that you're combining your clinical expertise and all the years you've spent working clinically with what the AI tool is recommending or suggesting, and that you use all of those things together to make the best decision, and don't rely on AI 100%.
Could you please elaborate on ethical issues that may arise when using AI-assisted care?
Sure, yeah. I didn't have time to go into it today, but the webinar that I mentioned for Sigma goes into the ethical issues to do with AI in more detail. There's several different aspects to it. And actually the WHO itself has a great ethical and governance framework to do with AI. And they outline 6 sort of principles around AI ethics. So things covering equity and bias, which I sort of briefly mentioned in the presentation today, things to do with transparency. So sometimes the way that the algorithms work aren't transparent, and that can cause sort of safety and trust issues if people are being asked to rely on them for sort of informing decision making. There's issues to do with sustainability, because the AI systems require huge amounts of energy and huge amount of water to be able to run data centers and crunch huge amounts of data. So they're not fantastic for the planet, but people are working on improving the efficiency of AI models and improving the efficiency of the hardware that's used to run AI models and tools, to try and make them as good for the planet and energy efficiency as possible. So there's a whole range of issues to do with ethics of AI, and there's more as AI develops. There'll be more and more issues with, I suppose, integrating it into our daily lives, and the positive and negative impacts it can have for professionals and for our patients. But do have a look at that Sigma webinar, because it does go into the ethics of AI in more detail.
Does the report include midwifery? In some countries, they consider midwifery a separate profession to nursing.
Yes, it does. Yeah, I appreciate there is some differences in how midwifery is reported across different parts of the world, but they do have some midwifery data in the report. And I think the recommendations are very relevant for both professions, especially in relation to the digital aspects of our education and the care that we deliver. So hopefully they're helpful for midwives as well.
Neat. Why is AI usage refused to be used in nursing research publications? Or why are they not using it?
Sure. I guess people are starting to use AI tools in specific areas of research, but just not for writing the final paper. And I guess it's got to do, I suppose, with scientific integrity, that the people who write up the results of a study and who conduct the study are the ones that are responsible for it. So if we hand that responsibility over to an AI tool, then I suppose it could create a lot of problems with with accountability and responsibility if research isn't reported accurately and correctly. So I know a lot of the publishing companies and journals have very strict guidelines now about the use of AI in publishing, but you can certainly use it at different stages of the research process to make different aspects of research more efficient. And I know colleagues are using it for systematic reviewing. They're starting to use it to inform parts of their analysis. And I think AI will always be a tool that will be there to aid us to do different jobs, but it should always be accompanied by human oversight and checking, because we are ultimately responsible, for the decisions that we make and the actions that we take, including publishing science. So do have a look at some of the guidelines that the publishing companies and journals have on their website, and they will guide you through how to use it appropriately in your research.
Are there standardized guidance for nurse educators for the use of AI in digital education and nursing?
Yeah, that's a great question. I think everyone, when generative AI sort of arrived on the scene, sort of became a bit overwhelmed with how to integrate AI into education. But now most universities, including my own, have clear policies and guidelines in place, both for students and for staff, about how to use AI appropriately. So I would, if you're based in a university, I would look to your own institution first to see what they're recommending. And I guess every country is different in terms of professional nursing associations. I know the American Nurses Association did publish a statement on the sort of ethical use of AI just generally in nursing. I don't know if it's specific to education, and I'm sure other professional bodies in nursing around the world are maybe working on documents and strategies for providing more robust guidelines to nurses and midwives about how to use AI appropriately. But certainly if you're based in university, I wouldn't be surprised if your university leadership have already got policies and guidelines in place that you can, oh, thank you for sharing that, Maureen. I've already got guidelines in place that you can use to help make sure you and your students use it appropriately.
Great. Well, thank you so much. I am going to provide the link once more for the evaluation in the chat.
Thank you.
And you do not have to rewatch the entire webinar to get credit so that you can go to the evaluation. If you've been on this webinar live, you can go directly to the evaluation and you can fill that out and you will get your certificate for one contact hour. Thank you so much, Siobhan, for all of this great information. Sigma is grateful that you took the time to share with this audience and look forward to hearing more from you in the future. We hope you enjoyed this webinar. As I said, and I want to reiterate again, just go ahead and I will email within a week link to the evaluation in case you miss it within the chat, so that you can go in and complete that. We will upload the PowerPoint into the repository so that you have access to the PowerPoint as well. And thank you so much for your time today. Thank you for attending Sigma's webinar. Take care.